Okay, this is Julie, who's going to have a Botox treatment today. So the first thing I'm going to ask you to do is to put a headband on, and so we can clear the hair from the face. And we've already done some photographs to look at the areas that need doing. So the areas that we're interested in are the frown area, which is called the glabella, and we're going to do the eyes, and I'll show you why that is in a minute before I do the marking. So, to start with, let's have a look at the muscle action. So, could you give me a frown, please, Julie? Thank you. So we can see there's a large bunch of muscle here, which is giving Julie these two lines called 11s. And relax again. And if you do it once more, we can see that that has been caused by the large muscle here called procerus, which is like a caterpillar, one each side. And when it contracts, it goes that way. It also partly pulls the eyes shut, which is unhelpful. And then the muscle in the centre, procerus, is what causes the ridge on the nose and the 11s. And relaxing that, so if we could stop that muscle from contracting, we would stop the angry frown, and we'd stop Julie from squinting and her eyes being closed so much. The other issue that Julie's complained about is, could you give me a big smile, please? The crow's feet here. So at maximum smile, she's got significant crow's feet. Also, you'll notice a lot of squinting. So with the frown, pulling the eye together medially in the middle, and the crow's feet, the orbicularis oculi muscle, pulling your eye closed at the outside, it means that in photographs she tends to have her eyes really very closed. The third area, which if you give me the rays, we have these horizontal lines. We're not going to treat those today, partly because she normally has her hair down, so it's pointless, it's not visible, but also because if we soften that muscle, this might drop the eyebrow even more, and we could end up with a little bit of a heavy brow. So that's the plan for today, is to do the glabella, the frown, and to do the crow's feet. So we'll start with a bit of cleaning. We've already been through the process of photographing Julie and deciding where we're going to treat. We've done the consent form and we know where we're at. So we're going to start with cleaning the areas, which I'm afraid will destroy your makeup. Let's put that back on afterwards. So that's the frown areas I'm going to be doing, and around both eyes. You've got your makeup with you?
I have, it's in my bag.
Good.
It's always in my bag.
That's what the other side. Oh. So people always ask if Botox hurts, so when I do the injections I'm going to ask you to answer honestly what each one feels like. So I've got a dose of Botox ready here. Botox is one of the many brands of botulinum toxin, and we use different brands depending on what we're trying to achieve. So, the first thing I want to do is mark up the muscles, which means giving you those expressions again. And if you could give me that frown, so the injections need to be in the muscles that are moving. And I'm marking those parts now. And what we will see, thank you, if you're relaxed now, is if you do the frown again for me, all of those dots move. That's it. So that means they're on the moving muscles, we're in the right place. If you do the smile for me, we need 3 in the moving areas there. Well out from the border of the eye, turn to me. Same again. That's it. 1, 2, 3. That's it. So those will be the sites of the injections. And we'll start in the middle. So, you can close your eyes if you want to, or not if you don't. And we'll start on that first one. So here we go. This is your first Botox injection. I'll put in the correct amount there. And out we go. Now, how was that?
Absolutely fine, didn't feel a thing.
Yeah? Good. Okay. Some of them you feel differently to others. I'm going to go higher up now. How was that?
That's fine, just like a little tiny scratch.
Okay. Now there's 2 on your left. Here we go. That's quite a big muscle there, so that's giving you a big dose. And the further out one. Okay. How's that?
Fine.
The further out ones, I
Yeah,
find,
yeah.
are a little bit more sore, aren't they?
Yeah,
Well, not a big deal, but you feel it more. Okay, you're just using a little bit from those 2, so we'll just stop that. Good. And now the remaining 2 on this side. So again, this is a big muscle. And the smaller dose goes in the tail of that muscle. And then what we never do is inject any further over the outer third of the brow, because that is the best way to cause the brow to droop. And we never ever do that. So I'm going to put some cream on. This is just anti-bruising cream. I'm going to leave that on for a minute while I go and get a refill.
Lovely.
So, do you feel okay?
Yeah, absolutely fine. That just made me jump a little bit. I think
Yeah,
it's fine.
yeah.
It didn't hurt, it just made me jump.
Okay, reloaded. Fresh needle. And some fresh, of course. So, around the eye, there's going to be 3 injections in an arc. And I always have to look for blood vessels first, because there's always some around there, and the object is to avoid those. Here we go, first one. And again. And finally. Okay, some cream going on.
I felt absolutely fine.
Yeah. Most people feel that the third one, the one on the cheek, sometimes you can feel, but the ones up here aren't so bad. I'll just come round to the other side. So what will happen now, we probably can't see it on the video, but there are little, when I've removed the cream, there are little bee stings, and they last about 15 to 20 minutes. It's just the volume of fluid that I've put in.
Okay.
That'll get absorbed, so within half an hour you'll look like there's nothing that's been done.
Lovely.
Then nothing will happen. Most people say that the effect comes on day 3, 4, 5, and when you try to frown, nothing will be happening.
Right.
You won't frown, and if you smile, your eyes won't pinch. If you really try and frown and do it really hard, you will still be able to, because other muscles will come in and do it. But under normal circumstances, the frown will go away. Same with the eyes. So in 14 days, when the Botox reaches its maximum effect, I'll be getting you back for a checkup. We'll have a look at your photos, do them again, and if there is any extra needed, because this is your first treatment, so I'm erring on the side of caution with your dose. So it might be that with those bigger muscles there, you actually needed a bit more, and if so, I'll give you that on your second visit, and that is free. And then what I do is I add the dose you've had today to the dose you've had then, and that gives me your total dose for future reference. So in future you won't have to contract. Okay, so you let your last set of injections just do this eye. Okay, some cream on that, then I shall come and clean you up in a second. So there we are, no big drama.
No. That's fine. So I'm okay putting makeup on?
Yeah, well, You were very brave at the doctors. So, initially, yes, you can put some light makeup on. What the risks that we discussed before we did this, when we did the consent, are bruising, obvious reasons. Infection if we didn't keep the needle holes clean, but it's such a tiny needle that the holes heal up very, very quickly. And the main risk quoted in the textbooks is this happening, and the eyelid drooping. But that only happens if this air is injected, which it shouldn't be, and it hasn't been, so that isn't going to happen.
Okay.
So what we'll do now we antiseptic to your face, is we'll let that settle down. You put a bit of light makeup on, and then we're done.
You've done it lovely.
Okay. Thank you very much indeed for your help today, Julie.
Thank you.